So the starting point for this discussion today is, of course, the Westmead Feelings Program, and specifically how the program can be successfully implemented by psychologists in private practice. And we're joined by one of the authors of the program, Dr. Belinda Ratcliffe, and also by Amanda Boyd, Karsha Bedford, and Jane Frankie, who are our practitioners in the field. And we're also joined by our resident ACR psychologist, Irene Lammy. So by way of introduction, Dr. Belinda Ratcliffe is a clinical psychologist with over 20 years of clinical experience, and she's the lead author of the Westmead Feelings Program 1 for autistic children with mild intellectual disability. Dr. Ratcliffe completed her PhD at the University of Sydney in collaboration with the Children's Hospital at Westmead. She evaluated the effectiveness of the Westmead Feelings Program in a treatment versus control group trial, during which 60 school counsellors delivered the program to over 300 autistic children in New South Wales public schools. Belinda has also been a lecturer in child and adolescent clinical psychology at Western Sydney University, and she's currently the Director of Clinical Services and Training at the Emotions Clinic Australia. In this role, Belinda continues to maintain a small caseload while undertaking research and providing extensive training and clinical supervision in autism, intellectual disability, and mental health for psychologists, allied health, and mental health professionals across Australia. As well as Belinda, we're also joined by 3 practicing psychologists who are currently delivering the Westmead Feelings Program in their settings, and who will have a range of questions for Belinda that I'm sure will mirror some of your own experiences out there. So firstly, we have Amanda Boyd. Amanda is a registered psychologist and returned to the private practice workforce in 2019 after having her 3 children, 2 of whom are diagnosed as autistic. Since this time, Amanda has been working more and more with children and families who are experiencing parental distress and emotional dysregulation, and she's seen many children presenting with an autism diagnosis, as well as other common comorbidities such as ADHD and anxiety. Amanda also has a diagnosis of ADHD, which gives her a unique perspective in working with these families. Karsha Bedford has a master's degree in psychology and over 25 years experience providing psychology services in the public and private domains. Karsha is passionate and highly experienced in promoting growth and independence in children, adolescents, and adults, and in particular those with additional needs. She's experienced in developing and implementing behaviour support plans for clients with complex, challenging behaviours. She's a member of the APS and the Association of Psychologists in Developmental Disabilities, and has been supervising and mentoring psychologists for over 15 years. Jane Frankie is the owner, director, and principal psychologist of Lighthouse Health and Education on the mid-north coast of New South Wales. She's a registered psychologist, primary supervisor, and qualified secondary teacher, with over 20 years experience working with children, adolescents, and their families in a range of settings. Jane has a master's degree in child and adolescent welfare and extensive training in the assessment and counselling of children and adolescents. Jane has been involved with the Westmead Feelings Program for the last decade, since the early implementation days, utilising it within schools across Western and Southwestern Sydney, and now in private practice in regional New South Wales. And last but not least, Irene Lammy is our consultant psychologist here at ACR. She covers both clinical and organisational psychology and has been a champion of the Westmead Feelings Program for many years. And I'm sure she would be a familiar face to many of you from conferences and seminars right across the country. So we're so lucky to be joined by such a wealth of experience, and what we're really going to get stuck into now is a 2-way discussion around how you as clinicians working with children and their families and schools can implement the program in real life settings to get the best possible outcomes for those children. So our panelists have some questions that we're going to use as a starting point for our conversation today, and I'm sure that they will resonate with the experiences that many of you will be having. I'd encourage you to submit your questions around the practicalities of implementing the Westmead Feelings Program to our Q&A box, and we'll try to work them into our conversation today as well. So without further ado, over to you, Belinda.
Thank you so much, Elisa. It's really exciting to be here today with you all. I'm just going to go ahead and share my screen. because before we get into the questions from the panelists today, I'm just going to give a brief overview of the Westmead Feelings Program, the program itself, and the research and some implementation in practice as well. So I did just want to acknowledge all of the partners and collaborators that have been involved in the development and research around the Westmead Feelings Program, because it has been definitely a huge team effort across multiple organisations. So thank you to everybody that's been involved. So with the Westmead Feelings Program, what are we trying to do? Well, we're trying to make a lasting difference in autism and mental health. We know that 70% of autistic individuals experience a co-occurring mental health issue like anxiety and depression, and these mental health presentations are particularly common in adolescents. So originally what we were trying to do when we developed the program was to try to prevent mental ill health by building social emotional skills in primary school age children. And so some of my own research actually found a link between social emotional skills and mental health. So what we know is that better social emotional skills produces better mental health outcomes. And so it provides an avenue or a way that we could potentially make a difference in this area by building social emotional skills. So there's very limited in terms of evidence-based programs available, and there's been a significant investment, particularly from the Children's Hospital at Westmead in Sydney, in developing, researching, evaluating and disseminating the program across more than a decade now. So we're really trying to close the gap between published resources that often don't have an evidence base and research where researchers often don't take that next step and actually publish their manuals and materials and actually make them available to real world clinicians for us to use in real practice. So if we're not familiar with the Westmead Feelings Program, there's two versions. We've got a version for primary school age children who also have a mild intellectual disability, and that's the program I'm the lead author on. And the other program, which I'm also an author on, which is led by Dr. Michelle Wong, is pitched at kids who have autism as well as no intellectual disability. And so I often think about the main difference between the two programs. Westmead Feeling Program 1 is for kids who can talk, but they don't necessarily need to read and write. So academically, they're going to be at a kindy year 1 level. In contrast, Westmead Feelings 2, these kids must also be able to talk, but it's really pitched at kids who are academically functioning at least like a year 2, year 3 level, and they must be able to read and write. And both programs are designed to be delivered in a group setting, and that's what our research has always been. But clinically, you can definitely adapt both programs to be used on an individual basis. So the Westmead Feelings Program looks like this. So there's 3 modules. We're teaching children how to identify their own emotions and communicate about emotions in Module 1, emotional problem solving and understanding others' emotions in Module 2, and how to manage emotions in Module 3. And we have separate sessions for parents and teachers to help support those skills to be able to generalise to real life settings. One of the things I really love about the Westmead Feelings Program is this curriculum is theory driven. It's based on theories of emotional competence, emotional development, and emotional intelligence. And the underpinning theoretical model is very powerful. It's a very developmental approach to teaching these really important skills. And we take a very evidence-based approach to the way we teach. So the content and the curriculum itself is research-informed and evidence-based, but the way we teach also draws upon research and evidence. So lots and lots of visuals, video modelling, social stories. There's a range of evidence-based techniques embedded in the program. So as I mentioned, the Children's Hospital at Westmead has sort of led the research, and I've been so privileged to really be a part of that in collaboration with a range of universities also. So we have done a lot of research, and this slide gives an overview of the different studies. So we've done studies in hospital outpatient settings, university settings, school settings, clinic settings, with a range of different Westmead Feelings facilitated psychologists, school counsellors, classroom teachers, allied health professionals, with a range of different approaches there. And we have had a focus on trying to get the word out and disseminate the results of the research, and we have presented at lots of national and international conferences. So these are just some of the ones that I've attended. The rest of the team at the Children's Hospitals attended even more. So have presented all over Australia and internationally as well, the results of the research studies at conferences, and of course we've published our research in peer-reviewed journals also. So what we consistently find is that the Westmead Feelings Program improves emotional competence. So that's skills in understanding own and others' feelings, emotion problem solving and emotion regulation. And there are improvements at the individual clinical level in terms of social skills and mental health. And we've got more research and papers under review and underway as well. And so one of the things I really enjoy is the qualitative research and hearing about the real world outcomes and results. So just a few little examples here from some teachers. During one session, a student talked to the class about feeling really sad because his cat had died, and it was nice for the students to say to him, "Oh, that was sad," having language around being able to connect and empathy. A teacher said, recognising emotions in everyday life went from zero knowledge to a large knowledge. So using the emotions and the strength bar, and that's been a big benefit. Another teacher spoke about a boy in a class who normally gets angry over lots of minor things, but able to use the problem-solving strategy when he does get angry, asking how we can solve the problem, how we can talk about it, and he can engage with that kind of process because he'd done the Westmead Feelings Program. So I always love hearing about the real world, actual on-the-ground examples. So I do have a clinical practice in a team. There's 10 of us clinicians that are all providing the Westmead Feelings Program at the Emotions Clinic. And so I think, I've got this really lovely research background and have done those, research studies where, as we know, there's, quite a rigorous eligibility criteria, and then we're implementing it in a really manualised way and collecting data, and that's so important to establish that evidence base, and then how to translate that evidence base into real life clinical practice. So it is taking that evidence-based approach, but then applying it to that particular child and family that's in the room with us. And so at my clinic, everyone comes in for an initial appointment, and we try to really meet that child and family with where they're at. And I've just got here some examples to show the range of flexible approaches that we use to deliver the Westmead Feelings Program. So in terms of the child sessions, yes, now I've got a bigger space in my clinic. I can actually run a group program, so that's super exciting, running it in the manualised way. Definitely also run it on an individual basis in small family groups as well. Our clinic is contracted to go into schools and run the program in classrooms in autism units, or pulling out particular children the school have identified. Pre-COVID, it was all in real life, but post-COVID, it's mostly real life with kids, but some telehealth. The parent sessions as well, pre-COVID, real life, but post-COVID, it's actually mostly telehealth. Sometimes we have the parent in the room with the child as an actual group participant, and sometimes there's separate sessions for parents. With teachers, we were pre-COVID sometimes going out and doing in-service training for school staff, so going out and doing a school visit to deliver. Post-COVID, it's been mostly telehealth, which has been going well. And I just had a few little quotes and examples here, and I think the slides will get sent out to everyone if you want to take a look at this. But this is some of my team members where I really wanted to set up a clinic where I could really train and empower that next generation of psychologists in the program, talking about their experiences of it. So clinicians enjoy the structure of the program and find it fun and interactive, and the kids learn these new skills. But one of the things we consistently find and that we love is that it's sort of these intangible, it's harder to measure benefits where friendships develop, where these parents might develop friendships within groups, kids might develop friendships if we're running groups, but it's often these conversations that might happen. And we had an example last week with one of the children's pet cats was old and sick and needs to be put down, but they were able to use the Westmead Feelings Program language and visuals to be able to talk about that, and parent commenting. It would usually have been a really significant trigger and really tough to manage, but instead it led to a really beautiful moment of connection. So as a little team, we love to share our experiences in all the positive benefits that we see from Westmead Feelings in our clinic. So I've just popped my contact details there if anyone wants to get in touch with me. So thank you for listening to that portion, which is a super quick overview of Westmead Feelings and the research and implementation. And I think now I'm going to hand over to Amanda, one of the panelists, who's going to introduce herself a little and then ask a question, and then we'll move into sort of a question answer discussion about sort of this real world implementation and delivery of Westmead Feelings.
Thank you, Belinda. So I am actually probably using the program more so on an individual basis, so doing that adaptation from, because it is designed to be delivered as a group. Just due to size, so our clinic's quite small, and to get a group together can be quite challenging. As you've mentioned, I love the structure of the program, and when I found this program, the one and the two, I really wanted to use it straight away, and we don't have the capacity at the moment to run groups, so I just tried to figure out how I can use this just one-on-one, which obviously it can be. I often will work with the parent and the child together or separately, and so I often use the parent booklet with the parent, and at times if I have permission to and consent, I'll then also be working with the teacher on the side. So it's a bit more probably work, but it's obviously helpful for the child in the sort of longer term, that everybody that the child spends most of their time with is on board and understanding the reasons why we're doing what we're doing. And I find that the program is wonderful at explaining to not only the child but also the parent and the teacher, you know, that underlying reason, that sort of, I guess, theory behind why we're doing this. Why are we talking about emotions? Why are we scaling them? You know, why do we then do that first and move on to problem solving and then sort of, you know, the perspective taking. So I echo the structure, love it. I love that you can, you have that, all those resources nicely sort of laid out there for you, and that you can, you know, the parents can walk away and have something in their hands, tangible, that they can continuously refer to. So love that. So, but one of my, I guess, questions that I find working with a few of the older children, especially when using module 2, is when we get to talking about understanding our thoughts, we get, I don't know what I'm thinking, or it's that sort of quite not there yet, understanding that what thoughts actually are, and how we have them, I guess, in our head. So being really creative, I guess, talking about what are our brains saying to us, but obviously a lot of kids, especially the kids I work with, there's not a lot of space between the thought and then what happens. It just kind of happens, and we need to retrospectively consider what we might have been thinking, what possibly we could have been thinking. And so I guess my question is around, how do we creatively help kids tap into that thought process when a lot of the time, you know, they are saying, I don't know what I was thinking. I just don't know.
Yeah. Okay, great question. Because of course this can be a tricky thing to teach. So one of the things we've tried to do in the Westmead Feelings program is put, I guess, some structure around how to teach something like, what's going through, what are our thoughts, and to identify that. So what we do is we try to have those examples of other people. So it's kind of like, if you were going on a roller coaster, what would you be thinking, and how would you feel, and what would you do, and if you were having pizza for dinner. So using other examples first and practicing those, and using examples from other people, and then moving to the child's real life examples. So one of the interesting things we've found with some of our recent research with these older teens or children a little bit older is that they often really do need that visual scaffold. So if we're just saying what we're thinking, it's often not quite enough. I know what I'll do is I'll go to my whiteboard and I'll make sure I'm drawing that thought bubble. And I was just doing this with a young person yesterday, actually, and they were having trouble with their thoughts, and it was getting all mixed up, their feelings and their thoughts and what actually happened. And I tried to use a similar format to the visual worksheets that are in Westmead Feelings, but try to draw it. And then sometimes I might need to adjust my language a little. Like I might say, what was going through your mind? And if they say the feeling, I'll put it in that's your feeling. And if they say what they were doing, that's what you were doing. But what was going through your mind, I find sometimes helps if I'm pointing to my head, what was going through your mind, or pointing to the thought bubble. If they're stuck there, sometimes you can provide a choice of what they might be thinking. So you could say, oh, that's terrible, I hate that kid. Or were you thinking, oh, that's so annoying? And sometimes I find when I give a suggestion of what the thought might have been and give them a choice of what they're thinking, they're like, oh, no, Belinda, that's not what I was thinking. I was thinking this or that. So there's a few ideas. Yeah,
no, that's helpful. I like to get the bubbles, and sometimes I get the bubbles and we cut them out, and then I'll actually do a speech bubble to show the comparison between what we might actually say and what we might be thinking. I find sometimes that's visually helpful. So I'm thinking this and I said this, because often kids can say, they remember what they've said. And so I'll put that in a speech bubble and then do the comparison. So this is what was your brain telling you? Did you say exactly what your brain told you? Or so sometimes that's helpful. But I am mindful sometimes I find some children, they're not ready to share what they're thinking yet. Even with my own kids, they might be a little bit worried if they're feeling worried that if they share that thought, they're not too sure how how we as the clinician or the parent will, I guess, take that, or what reaction we might have. So sometimes I find normalizing or kind of sharing, well, in this situation, I thought this and I said that, helps bridge that gap to make them feel more comfortable sharing.
Definitely.
What they're thinking.
And we do this a lot in Westmead Feelings with using self as an example. So anytime I get stuck, I do use myself as an example. And I like that idea of the speech bubbles, and you might draw like a little picture of the child, and then the heart, like what were they thinking, and then the thought bubble, and then the speech bubble, and then you can draw yourself or your mum or whoever else is in the room, and use yourself as an example of what you would be thinking and feeling in that same situation. Sometimes it's just they need a little bit more practice as well. And if you're finding consistently it's a little bit too hard to use that language or examples on their own life, then you might just need to go back and do a little bit more on other people's examples, and get more practice at the skill before they can start to generalize and apply it to their own examples.
Yeah, thank you. No, I do. Yeah, I find that too. Sometimes we are going backwards just to go over things before we start going forward, which is another thing I love about the program. It's got that diversity. We can go backwards and forwards. to re-go over things to help reinforce what they might have already learnt. Another question I had was around more with parents. I often find by the time we get to, say, module 3, either in using the program 1 or 2, and we start to get our resources together, I guess I find sometimes, obviously, the parent is finding it difficult if there's not an immediate sort of result, as in this is working all the time consistently, and just helping them trying to persist with using the strategies, say the happy bag from the program 1, and using that bag or those resources and having it, and not kind of giving up that, oh, it's not working. Just creative ways to help parents persist and have that understanding that, it might not work today, it might work tomorrow. Just that reassurance around it's more of I kind of call it like a tool bag. We have lots of tools in there, and sometimes we might need more than one. To problem solve, we might actually need to move through a few things, especially around if there is a big feeling, we're at a number 3, we're really big and we need to really bring it down. It might involve having the happy bag being used multiple times. Just how to reassure, I guess, parents with that sort of process, that it will be helpful in the longer term, just sort of sticking with it.
And I mean, these a lot of these families and parents have a lot going on, so I always kind of try to have that big picture hat on as well. Sometimes there's just a lot going on for families, and that co-occurring mental ill health we might see in parents, and they might be stressed or depressed or have a lot going on for them, and just trying to meet them with where they're at. Some parents, of course, do need a bit of extra help and support around. It's that kind of problem solving, isn't it, in the moment. But I love kind of the shared language, because it's like, okay, if something hasn't gone that well, what happened? How did you feel? And how strong were your feelings? What were you thinking? And I wonder about the child's experience. Because we've taught the child the skills to have that conversation about what happened and how are they feeling, and what could we do differently next time. And it's sort of that process, because it is about, it's not so much about a skill, it's about kind of emotional development. And it is a developmental thing. And we often find, particularly, of course, there is that genetic load with autism. Often, an autistic child, there is that strong genetic load, and we might have parents also having features as well, which is okay. So the parents just might need a bit of help generalising the skill to a different situations, or some reassurance that, that's okay, we can just work through that and problem solve that together, and they just might need a bit more support and scaffolding and practice. And I mean, there's always that nice little saying that I often say early on in an assessment or therapy, if I could wave my magic psychologist wand and make everything all better straight away, we would all do that. But sometimes it is a process, and it does unfold. I just think it's great that you are engaging the parents, you are helping and supporting them. You can reassure that sometimes other parents find this stuff too, but we know, I love the saying, what we know from the research is this program can be effective for lots and lots of kids. So it's something some other families have found tough, and let's talk about it and see if we can figure it out. And try
thank you. I echo a lot of that, and it actually leads me into my next question, which is around, I guess, from a clinical term, that rigid thinking in the adults, because of, have you ever thought about doing one for grown-ups? Obviously, I love this program a lot, and I actually do use it, like the underlying sort of emotional competency, problem-solving, perspective-taking sort of areas to discuss that with adults who might be presenting with the difficulties around emotions, problem solving, and understanding others. And so I'm just wondering if you know of other supports, or if you are aware of other supports that really work well with adults in this area, especially when we are working with, like you said, families with an autistic child, more than likely working with a family that's themselves autistic with their different levels of competency in emotions, perspective taking, and problem solving. So yeah, are there other sort of more adult focused programs out there that we can help sort of, I guess, supplement for the parents in the situations that are also trying to learn these skills? I actually think your program with the parent handouts and the booklet actually does it really well, and it's like we are the programs for the child, but it's actually for the whole family, and that's why I do love it so much, and I love working with the grown-ups in the situation as well. But yeah, I guess I was just wondering if there's other resources out there that we can also provide with the parents to reassure them, yeah, that this isn't a really strong program and a really good theoretical sort of underpinning of helping not only your child but you as well.
Yeah, I mean, there's not that I'm aware of in terms of something for grown-ups, but I think clinically I do something similar to yourself, where now that I've got the theoretical framework, first we teach emotional understanding in a way to communicate it, and then emotional problem solving, perspective taking, and then emotion regulation, and then trying to adapt that with some age appropriate resources. So of course, yes, that's on my list of all the many things I'd love to make. And in the meantime, I think you're right, joining them in sessions. Certainly I've run the Feelings program with parents as participants, and I'm a participant too, and we're all joining in. And I'll often try to get both parents, carers, siblings in, and that can be really beneficial. Sometimes we get to the end and maybe dad's still needing a little bit more practice. I've repeated the program, I've done that, and that's been helpful. So sometimes, individual work, individual sessions, but I can't suggest or recommend any particular resource or program that's doing the same thing for adults. So if anyone out there knows of something, let us know. We will, I think, love to hear about that. Yeah.
No, I like that idea of having the mum and dad and yourself as participants and making that clear that we're all doing this together, rather than having I'm the clinician, you're the client dynamic. I do like the idea of sort of we're doing this all together and we're going through it together. Yeah.
Definitely. I really liked it like that too.
Yeah, I think that's a great suggestion. Thank you.
Oh, thank you, Amanda. Okay, so we might move over to questions from Kasha. Hey, Kasha.
Thanks, Belinda. Just at my practice, I have a practice in Penrith in Sydney, and we primarily support children and adolescents on the spectrum and with intellectual disabilities or with other particular special needs. So our practice has actually been running the Westmead Feelings Program for a couple of years now, and with great success, which is fabulous, because I have a number of my staff, I think 4 or 5 of us are actually trained in the program. So actually, because of COVID last year, we were actually able to move our program because we couldn't offer it face-to-face with all of the restrictions that were in place. We were actually able to offer the program online for 3 terms, and we had wonderful success. I wasn't sure how it was going to go, but it actually went really well. We required parents to be really with their children online to support them through the program, but I actually found that that was really beneficial. And we had some really positive outcomes, and parents really appreciated that they could continue with the program. It didn't have to be cancelled. So since COVID restrictions have actually lifted, we've continued to run the program, but we are doing it face-to-face. We do the parent and the teacher component of it online because we're finding that parents and teachers are so time poor that they're actually requesting to
continue to have those components of the program online so they don't have to rush to pick their child up, get their child into the clinic and whatnot. So my question to you is, in the future, do you see any issues with continuing to run the whole program online, only because parents are actually asking for it, and so that they're not rushing around to appointment to therapy to another appointment? Is there any, I guess, disadvantages to continuing to run it online, and will there be any, I guess, impact on the evidence base of the program because it actually wasn't designed to be an online based program?
Yeah, great question. And I just love hearing about your experiences and your flexibility and your adaptability during that COVID lockdown. And it sounds like you really had some positive outcomes. So
yeah, we did.
Yeah, really great to hear of your experience. And I think I've probably had a similar experience in my clinic. And similarly, we're running the face-to-face groups for the child sessions, and the parent and teacher sessions, we're delivering them via telehealth. Still live via telehealth,
Yep.
everyone can kind of come together and get that, individualized problem solving and support from the psychologist. So fantastic. So I think on the ground, clinically, we're onto something. And one of the things I really love about Westmead Feelings Program and the team is that there is this real commitment to the research and the evidence base. So I know that there is a research project that's currently underway looking at clinicians' experiences of online delivery and telehealth delivery of Westmead Feelings. So I may well be in touch with you after the webinar to include you, to get your experiences and your feedback around that. So I think because we've got the theoretical framework and we've got the resources, I think clinically we can feel reasonably confident, particularly when we're noticing at that individual level. We've got our own outcome measures and we're still noticing. Of course, one of the things that we've noticed is a few adaptations might be needed. In certain children are going to be the best fit is going to be in real life. And other children, they're going to be okay with that telehealth delivery. And so I guess it's something I'm really passionate about is let's meet this child and family with where they're at and try to kind of deliver, flexible option that helps them meet their individual goals in a flexible way. So
yeah. Awesome. Thank you, Belinda. So my other question was about costing of the program. So because a majority of our clients in our practice have NDIS funds, and I know how I've been costing the program for NDIS, but I'm not sure, is there a clear, I guess I'd like to hear from you how you cost the program in your practice for NDIS clients, because I'm not sure if I'm undervaluing the cost of the program or overbilling the cost of the program. I guess I'd like some consistency around how psychologists in general should be billing for the program for NDIS clients.
Yeah, it's such a great question. And I know even for myself, it's something when, other people aren't necessarily doing it yet and you just, oh, what should I do? And looking to other people. And I know that's one of the reasons I decided to really kind of invest in setting up my own clinic so that I could sort of be on the ground and providing this advice. And I think we're all still learning about some of the best ways to cost a program like this. I think it is a very valuable program and it is time consuming and comprehensive. So I know that I've got a particular practice where I'm really committed to gold standard, evidence-based, and really delivering things to that highest possible standard where possible. And other clinics are going to be meeting a different need or offering a different type of service. So I think everyone has to look at their own service and what is going to be best. What are you trying to achieve and what are you offering? I know at my clinic, we see people that are NDIS self-funded. So this, is going to be an approach that works for us. Whereas other clinics, they might be NDIS registered, and then they might need to stick to the rules around billing for groups. NDIS registered providers might be billing with the amount that is recommended by the NDIS. I guess what I would say is just be really mindful of your time and how much time you are putting into it. And so you would, it would make sense to be writing a costing that includes your time for running the group, setting up that room, writing the notes, and putting it all together. I guess that's what we've done. I guess we've applied our usual billing practices and in quite a really clear, transparent way. For me, I think that's really important. Listing out what's included and then just putting it, applying those usual billing practices to it. Yeah.
We are an NDIS registered provider, so we do bill at the group rates, but I was just wondering, it's really difficult because if a participant's plan doesn't allow for that much funding for over the 3 terms, it can be really difficult because parents really want to participate in the program, or the plan might end mid-program and then they're relying on the funds to come through for the next part of the term 2 or term 3 of the program. They may not have it. So I'm just running into little issues like that in terms of costings. So like you said, we have been billing as per the NDIS group rates, and it seems to be effective, and we've got a lot of parent uptake for that. So I'm just continuing as I am, but I'd be interested to hear how other people are billing.
Yeah, I'm happy to share, Pasha.
Yeah, great.
So in our practice, we're not registered providers, so we're similar to Belinda, self-managed and plan managed only. But that issue with plans running out or then the rollover and can the child continue in the program, I ran into that a couple of years ago. And so we put a standard, rule in place that when children were identified as potentially having value from being a participant in the program, then we would wait until they came up for review, and we would put that through in our NDIS report that the recommendation was that they would be participating in the WFP, and that it would take 40 weeks as a minimum, this many sessions at this rate. So it was really clear. And then what we found in our regional location is the LACs are running with that, and they're ticking that box. It's being put in the participant's plan. And then when they come back and we've got our numbers, then that participant starts from there under their service agreement.
Yeah, perfect. So we also add it in our NDIS review reports, but sometimes there's just no guarantee that they will get the funding, as you know, that they actually need to complete the program.
Linda, can I jump in as well? There's a couple of questions in the Q&A here. So there's one from Bridget, and she's asking what the usual NDIS group rate is. I'm not sure if you can answer that one. And then also there's a question from Janice. She's been waiting a little while about running the group programs for families, how you think about whether there is inclusion criteria or exclusion criteria to make the program work within a group setting. I'll leave you with those.
I'll let Kasha answer in regards to the NDI because she's the registered provider in the panel.
So the group rate is actually $71.47 at the moment per hour. And that is for a group of at least, it's changing. So the group rules are changing as of the 1st of July, and it will depend on how many participants you have in the group. But at the moment, it's still the $71.47.
And how many hours would you bill for? Would you do like 2.5 or?
Yeah, oh look, we've been doing an hour and a half each week. So we can do an hour and a half each week, and that's the face-to-face, and that's for the duration of the term. So we do it term by term as per the program. And depending on how many participants you have, you generally need another person to run it with you, because obviously there might be some challenging behaviours, there might be some attention and concentration issues, and some compliance issues, which we all know that we have to manage as well. So you often need an additional person. So yeah, it can be quite expensive, and so I guess you've got to really price it for how many participants and how many staff members you need to run the group.
Yeah, I mean, I wonder about if it is possible to consider 2 hours of time or maybe even 2.5 hours of time, because there's that room set up, there's the delivery, and then there's the note. So with one of the nice things about the NDIS is we are allowed to include some of that in our billing. So I do hear of other service providers that are, really costing things, appropriately. And so also kind of thinking flexibly about who that assistant might be, whether it's taking students on placement, whether it's,
A provisional?
Provisional psychologist, what a great learning opportunity for them. And, when I go, or when myself or any of our team go into schools, we have a teacher as the assistant. So trying to think flexibly about that. I do think we have to value ourselves, and I do think it is a comprehensive program. And I know one of my colleagues at the Children's Hospital is really interested in sort of the cost effectiveness type of research study, which would be incredible if we could do that, because perhaps the program costs $5,000, but what an incredible investment, because it's evidence-based and it does actually work for like a lot of kids, and it does make a real difference. The kids can get these packages of, $5,000 for psychology. Like, what a great investment to put that towards. So it's interesting to hear from people. In terms of the eligibility criteria, for groups, I guess we're screening for, is there any significant risk issues? Does that little munchkin like to run away, hit other children, things like that, and how much support might they need? And can they, concentrate and pay attention and all those things, and, to be able to participate safely in a group in a private clinic, or are they best suited to more of an individual or family style situation? So it is often that kind of co-occurring, behavioural challenges, or, of course, if somebody has like a mental health issue and they're, really quite depressed or anxious, we would always kind of stop and treat that first using, evidence-based mental health treatments, because Westmead Feelings is not a mental health treatment. It's more pitched at prevention and early intervention and building skills. So you're trying to prevent that onset of mental health by, building skills. But if someone, we increasingly, especially since that COVID lockdown, get these little 10-year-olds coming in really anxious, depressed, sometimes they're, suicidal, or they're hurting themselves, we do have to kind of treat that first, using evidence-based treatments, cognitive behavioural therapy or other approaches. But then when someone is stable and well, then that might be the time to go back and build some skills in something like Westmead Feeling.
Linda, I'll allow you to move on to Jane.
Thank you. Thanks, Jane. Over to you.
Thank you. It's good that we just had the question about, or talking about schools and teachers in there. So in private practice, I've moved into private practice after being a school counsellor in schools. So I had scope in the schools to access multiple students, parents, teachers, everybody was available at the tips of my fingers. As a private practitioner, clients are obviously on board, as are parents, very much so. But of course, the clients come from a range of different schools. And one of the things I do intend on doing, or I intentionally do with my clients in the group, is I try to make sure that they have no prior knowledge of each other. So I choose students who match personality and behaviour management wise, but also the fact that they're from different schools, so that they're not bringing with them any of that other, I suppose, background. So then my struggle is getting the teachers from 4 or 6 different schools all on board at the same time to be able to participate, to support their student in the classroom. My teachers are more than happy to accept the resources. They really do try to utilise them, but that prospect of sitting down and doing the modules as a learning program, I'm finding a bit of resistance there. Even though the parents are more than happy to cover all the costs involved, there is that resistance. And I'm just hoping to get some tips from each of you on how to get teachers on board in private practice, just to provide the best outcomes, because I know if we have that 3-way system, our kids are going to get the best outcomes. And I'm only getting a 2-way and sometimes a half of another.
I know it is so hard to sometimes tolerate that, oh, it's good enough, but we know it could be better sometimes. But this is attention. I've been a school psychologist as well. You know, when you're in schools, you get access to these, you know, kids and teachers, and it's fantastic. But of course, when we're in schools, we have the opposite problem. Sometimes what we find is parents can be harder to engage. And then in our private psychology clinics, we've got the families, we've got the kids, but then schools can sometimes be harder to engage. And so I think it's incredible that you're trying, and I think that's really all we can do, and try to offer flexible options. Post-COVID, the option for telehealth delivery of the teacher program has been a game changer for us. And look, if that teacher can't, and you know, these poor teachers, they are just under, you know, they've just been through an incredibly challenging 12 months. I have just so much respect for these teachers, and they're being pulled in all different directions. So they're going above and beyond to spend, you know, an hour and a half in a group learning about this program. So I think I've had success with the telehealth, success with kind of trying to engage with the school. Sometimes we do send out letters like to the school principal, letting them know about the program, helping them get excited. It's sometimes helping them see it's not just to help, you know, little John in year 3 in this particular class, but it's actually upskilling in a way that has the potential to, you know, be part of their professional development and help other kids. We have recorded our telehealth sessions when teachers haven't been in a position to come at the time of it. And we have been tried to be flexible after school, sometimes evening appointments. You know, we keep experimenting to see where we're going to get the most people show up. And just, you know, try to keep encouraging each other in our team that we are, you know, doing the very best we can, and this is the real world. And so it's okay. It's okay to just really try our best and try to, you know, be flexible and problem solve. Yeah. What's the other panel members found? What have you guys done?
I've done, I've engaged teachers by doing a school visit. So as part of the program, if I'm getting feedback from the parent that things aren't going that well at school, I'll touch base with the teacher and do a school visit with their individual funding. And just going out and meeting the teacher and seeing what's happening in the classroom, how they're using the resources. That can be really beneficial, and just giving them some face-to-face advice in the classroom and in the situation, because you don't always get that opportunity to do that.
I love that.
Yeah, I do something very similar. Some of my little people, I actually do the program in the school with them, because it's so concrete when they're in class. If most of the difficulties is with regulation, say in the classroom, it's really concrete. We're in the classroom, we have the resources, and in the moment, not in the moment, but we can talk about, I noticed your worried face, you know, I noticed you looked worried, and what were you thinking? And we actually can step through it in the moment with them. Because sometimes it is that generalization. So if it's in the clinic setting, it's okay here, but then when we go into the, you know, the school setting, not sure, because of the, you know, some of our kids actually are such experiential learners that we learn it in the place where they are. And so sometimes I will go to the home, and we'll do some things in the home, and then we will do some things at school, so they really have that concrete learning experience in the situations that they spend most of their time in.
Thank you. Yeah, that's a great idea. Okay, I do have one more question. I know we're really time poor at the moment now. My second question is, again, same as Kasha, during COVID, went into lockdown, mid-program, moved to telehealth, had great success. And just hearing then around Belinda recording for the teachers, I was doing that for parents who couldn't log online, using the PowerPoint, recording myself and sending it out. So I'm wondering, is there scope, or is there a little bit of a plan out there to maybe create an online program where teachers could potentially be logging on themselves and doing that self-learning facilitation of the program, rather than relying on myself as a facilitator or other sites?
it's great to hear this is coming out of the webinar today, that there is that demand and that need. So I think there's this, research that's being undertaken at the moment, but it's great to kind of be able to take that feedback back to that wider group and team, and to just, let people know that that's wanted. And I'm a big supporter of us moving to those types of options too. So
yeah, an online program would be fabulous. Thank you.
Well, Elisa, do we have any last questions for our last 2 minutes?
Oh, one other question just in the chat now. Can preschoolers access the program, 4 and 5-year-olds? I think I know the answer to that one. I think they can use the Westmead Feelings Program one, so long as they can sit still for 5 minutes and they can, listen to instructions and they can draw some pictures and things. So they don't need to be literate, but they do need to be able to pay attention and draw things or circle things or recognize, colors and things like that. Yeah. So we're out of time. I can't believe it. This hour has just flown by. It's been so great to talk to you all. Thank you all so much for joining us from all over the country. And thank you for your contributions to our discussions. So special thanks to our panel members, Jane, Karsha, Amanda and Irene, and of course to you, Belinda.